Welcome, everyone, and thank you for joining us for another episode of Xanax Executive Insight Podcast, where we bring together industry leaders, innovators, thought leaders to discuss the trends that are happening, shaping the future of business, technology, and cybersecurity. Healthcare, in particular, is at a fascinating crossroads. Organizations are under numerous pressure to improve patient outcomes, reduce costs, navigate evolving regulations, embrace AI, defend against increasing sophisticated cyber threats, and do all of this while maintaining a workforce shortage and financial constraints. The reality is that technology alone isn't the answer. Success comes from strategy leadership and making the right decision before problems become crises. That's exactly why I'm excited about today's conversation. Our guest has spent several years helping healthcare organizations navigate complex challenges, improve operational performance, and build strategies that create lasting values. Today, we're going beyond buzzwords to explore what healthcare executives should really be focusing on as they lead their organization into the future. Our guest has spent several years helping um, healthcare organizations. So whether you're a hospital CEO, CIO, CISO, physician leader, board member, healthcare consultant, or simply passionate about where healthcare is headed, I think you'll find today's discussion insightful, practical, and hopefully inspiring. So let's get started. Please join me in welcoming our guest, John Cross.
Hi,
Um,
Kevin.
Hi, John. It's great to have you with us.
Thank you.
John, to start, why don't you tell us about yourself, the audience, get to know you a little bit about your background? Go ahead, please.
Absolutely. Well, thank you, first of all, for having me and inviting me onto your podcast. Yeah, so I have been IT and technology since 1990 or so. Got my career started in the Marine Corps as a software developer, where I was building data analytics and data warehouses before we even called them that. Translated that into a bit of a career outside of the military, doing data analytics. That's when I used to get my hands dirty before I got into management and leadership. And then moved on to, I worked for many years for an outsourcer, multinational, large MSP and outsourcer, where I managed many clients from various industries, from insurance through healthcare. And the last probably 25 plus years of my career, I've worked in healthcare, both on the payer side and the provider side. Both as a outsourcer, and then also what I like to call on the buy side of that equation, right? So I've also been the CIO of a rural hospital, where I think they present some unique challenges in the rural hospital space. And then beyond that, I've moved into consulting with my current firm, PYA, where I am a principal consultant with the IT advisory and audit assurance group, and with a focus on healthcare clients.
So, one of the reasons I was excited having John on this podcast is his uh, very diversified background in many fields that brings it all together from hands on development all the way to strategic consulting in healthcare. That is a unique perspective. So, before we dive into specific topics, John, I'd like to start with a broader question. And the question is that healthcare has changed dramatically over the past few years, from digital transformation and AI, cybersecurity, workforce challenges, reimbursement pressures, changing patient experience expectations, all of that, and then some. So, from your perspective, what do you believe is the single biggest challenge healthcare executives are facing today?
So I would have to say, and this is of course coming from my lens, right, which is an IT sort of focused lens. I would say IT delivery and maturity is one of the areas that healthcare executives find challenging today. Um, and when I look at across my client base, when I look at my experience and the like, there are a number of things that just from an IT delivery perspective, and just the entire delivery model. Again, whether you're developing software or buying software off the shelf, IT is not just a singular function. It's not just plumbing, right? And so, a true mature IT delivery function is included in every conversation, because you can't separate these days, you can't separate the clinical from the technical, because technology is involved in every aspect of care delivery. And so, whether it's discussing a new, MRI machine that's being purchased, or deciding on which AI platform to invest in for various clinical activities or administrative activities, including AI, including IT rather, in those conversations, shows a real level of maturity that not a lot of organizations demonstrate.
Well, that's a pretty complex situation. So let's start and dig into a little bit more of something that is everybody's mind, and it's really critical today, and of course as it matures for the future, and that's AI. So how is
Sure.
AI changing healthcare?
Well, so and that's exactly the point about the IT maturity model and the organization's maturity around the use of IT. I believe in the beginning it was, and when we say the beginning, right, the AI life cycle and the AI history, right, is not very long. There's a lot of changes in AI, as a entrance into the IT ecosystem, right, it's relatively new. And so, but when we look back over in the beginning of AI, it was perceived as perhaps just a technical solution. And we know now that it can't be treated just as a technical solution. So, when you look at how AI is ultimately changing healthcare organizations, I would say that it's primarily administrative, in the sense um, that it is capable of assisting and helping with the basic blocking and tackling of healthcare delivery. And let me pause right there for an edit. Um, was the question AI challenging healthcare consulting or AI healthcare in
Customers,
general?
in
Yeah.
general,
Okay.
customers.
Okay. So I'll pick back up with my thought. So, um, where I see it is administrative mostly. That is for things like some of the basic blocking and tackling of any healthcare organization. For instance, on the administrative side, assisting with coding, assisting with billing, assisting with claims denial, those kinds of processes, right? Those back end processes. And I think that there's a big impact, and there's still potential to be mined from an AI perspective in the healthcare delivery system in that arena. When it comes to the clinical side, you also have the sort of administrative task of the clinical experience, and that's things like ambient listening for scribing notes and those kinds of things. Even some of the more sort of, they're not necessarily esoteric, but some of the things that aren't necessarily customer facing or patient facing, like just making sure that drug interactions are taken into consideration properly and effectively, and whenever a provider is writing a script or a care delivery plan, assistance with those kinds of things. So all of those things are where we see the most impact at the moment in healthcare from an AI perspective.
So from what I'm hearing from you, it's no longer hype, it's reality. Is that the right conclusion?
So yes and no. There's still a fair amount of hype out there, right? So just AI in general has a significant amount of hype that has to be cut through. And so any, you know, erstwhile project or program or vetting, as it were, of an AI system, or what a vendor might come in and tell you that an AI system can do, or an AI enhanced system can do, all of that has to be looked at with a, for lack of a better term, a jaundiced eye, and not to just simply take the AI vendor's word for it, right? I think that's a real challenge, because the industry is moving so fast. AI is moving fast, and then the subsequent uses of AI is moving quickly. And therefore, there's this pressure, right, on leadership to also move very quickly, because otherwise they might be perceived as behind the curve, especially if you're in a competitive healthcare market. And also, you don't want to just be left behind. If there was real savings to be gleaned from AI, then you want to get those savings as quickly as possible, like everybody else, right, in the news cycle is saying that they're getting, right?
Yeah.
But you can see even the AI vendors themselves, right, have um, they tried to sort of drink their own tea, as it were, and then realized that maybe that's not the best approach. So you had, I believe it was the head of Anthropic, right, who came out early on saying, "Oh, AI is going to replace all these jobs, right, and it's going to do all these kinds of things." And then a year or two later, he's saying, "Well, it's not really going to replace jobs, but it'll enhance jobs," right? And so
Yeah.
there is a reality to all of it that has to be cut through. And if you're just taking the marketing slides, if you're just taking the industry hype, if you're just getting that from a conference or something like that, then you would do yourself and your health system a disservice if you're not doing the next one, two, or three layers deep, right? We used to say the ask five whys, right? So if they say this is the way it is, why? They say, well, because. You say why? Well, because. Why? And if you can get to five, then they got a pretty justifiable reason for why, all the way back at the top of that stack, they were saying what they were saying.
So there's also the issue of AI sprawl, right? So you get Anthropic, you get OpenAI, ChatGPT, DeepSeek, Meta's. There's literally, the last count that I did, there's like tens and tens of type of AI systems out there. So that sprawl opens a huge security issue, right? Shadow IT and the things that people are going to on their own, that risks the privacy issues, and because it connects to the outside world, obviously opens up a channel into the environment. So AI governance has become a big deal these days. And I was wondering, what are your thoughts on AI governance in healthcare? And is anything being done to control, discover, govern, and control the use of AI within an environment to reduce risk, provide the value, but reduce risk, and have a control over what staff are doing or what the systems are doing, while it's clearly and definitely needs to be protected.
Yeah, so there's a lot to unpack there, but to kind of cut through, there's a difference between the embedded AI, just for the sake of conversations, right? There's the difference between the embedded AI or an AI specific solution, right? That you might be sold, for instance, around coding or around ambient listening or something like that, where the AI is effectively a black box. It's embedded. It does supposed to do whatever it's supposed to do, and it's tightly controlled by the software vendor and by the lifecycle. And then there's the sort of where you're going with it, which is the sort of wild west, right? And that is on the chat side of things, or the bot side of things, and everyone having access to free tiers of AI chat bots, like or generative, I should say, systems, like Copilot or Anthropic, Perplexity, you name it, right? Everybody
Yeah.
can go out there and they can query the world, right? And I think for the most part, there's some real value in that. I mean, there's some not just tactical value, but some real strategic value in having access to those kinds of tools, especially as they enhance things like research and analysis and other things that you might be doing on behalf of your health system or what have you. But you are right in the sense that the biggest single, well, that might be overhyping it. The biggest threat, one of the biggest threats, amongst the many threats are, it's a Monty Python reference. Amongst the many threats are the use of these AI open systems and frontier models in an ad hoc manner where you or purposely or inadvertently wind up putting PHI or company confidential information into them, and then not knowing fully what's happening with that information behind the scenes, right? So,
Mhm.
yes, there is a big emphasis, and I think everyone in healthcare kind of understands the basic blocking and tackling of they need to control access to those tools, and they need to make sure that the workforce is trained on how to use those tools, because just like I can use a computer asset from my organization to do things, either side work or nefarious things or things that wouldn't be safe for work or whatever it is, I can also use those tools if I'm only controlled by policy, right, and not by the technology itself. Then I could, again, it's Wild West. I could do whatever I want to do with those tools. So the first step is the training side of the equation and making sure that everyone is fully aware what they can and can't do in those models and in those tools. And it starts there. But I do have clients of mine and where I have advised and where they are doing some of these things on their own, as well as based on some of my advisory, that you should block some of those things, if not all of them, right? And when it comes down to it, as you mentioned, it starts with governance. And you have to have an appropriate and effective governance. And appropriate simply means you have to have one, and then you have to use it, right? So you can't just say, I'm checking a box that I happen to have governance in place, but it actually has to be an active governance body that is making decisions and then implementing those decisions and managing against those decisions, and that
Right.
the everyone from the board down is in support of those decisions that that committee is making. And then on the technical side, implementing those decisions where possible. So, one of the first things that I advise, and this is clearly from a US centric perspective, is that all of the frontier model tools, whether it be DeepSeek or Grok or any of those that are out there, ChatGPT, whatever, that if it is a foreign state run or even a foreign company, those should be blocked outright until there's been a proven use case for those to be opened up. And so I'm talking physically about blocking them, going into firewalls and creating whitelist and block lists so that these sites can't be accessed inadvertently or on purpose by your workforce. And so um, from there, then the governance is all about, do I have a use case for this particular application? Do I have a use case for Copilot versus Anthropic versus Perplexity? Where is that, and is that justifiable? And the obviously the committee has to manage, one, they have to identify the risk associated with that particular site or that particular tool, and then manage against that risk.
Yeah.
And that's where I think one of the biggest challenges that we have today. You mentioned the frontier models that are out there, the tens models that are out there, right? But if I go to a place like Hugging Face, and I look at the number of models that are out there, open weight models that are free to use, that are based on various frontier models, there's over 2 million. And so even when you consider the fact that you've got access to these tools through a vendor provided UI, right? So a vendor provided application, whether it's on your phone or your computer or whatnot. There's also the reality that it's not just development teams, but other individuals might pull down some of these open weight models that are free to use and could use them for their work. again, if that is not controlled and governed, you get shadow IT happening, and
Right.
then you get, the Wild West. So, so to sum it all up to your question, when you look at all of the various models and the tools out there, again, depending on the classification that you're looking at, it all starts with governance. And just like IT maturity that I mentioned before, this idea that I have an AI governance committee or don't have an AI governance committee, that shows a level of maturity, and then how you use that committee also informs that maturity to ensure that it's effective.
Well, John, I just want to add a little bit more color to this. I just want to mention to our audience that there are actually tools available today that allows at an enterprise level to discover what AI tools are being used, put some policies around them, and also see how they're being used, and put some controls on the text that are being going back and forth to monitor it and actually stop it from misuse or abuse. So those technologies are available, and I think there is a significant amount of value to these tools to allow the organizations prevent something happening, particular in terms of breaches and potentially impacting the organization as a whole. Because some of these tools that are connected to the outside world, if there's any vulnerabilities in them, the hackers, the bad guys, can come through that door, and that's how you can organization can control that. Having said that,
Yep.
that leads me to a kind of associated topic with this, which is cybersecurity in healthcare. And we talked about AI and potential risk of AI in terms of cybersecurity because attackers could come in that way. But in general, cybersecurity is no longer, people don't perceive it uh, any longer to be an IT issue. It used to be, hey, this is an IT issue. But we've learned that now organizations don't consider an IT issue. I want to get your perspective on how the clients that you're talking to, hospitals, clinics, and the like, are perceiving cybersecurity. How do they manage it? What are the challenges? And what do you recommend for our audience who are looking at this and say, well, I've got a cybersecurity issue? What are the next steps for them to take in order to protect themselves as a healthcare organization?
Yeah, so I think it does come down to a fundamental philosophical approach, right? And as you've mentioned, um, it's gone from the conversation has gone, and rightfully so, from this is just an IT problem to this is a health system problem. It would, and I'd look at it this way: it's no different. And again, every analogy breaks down at some point, right? But it's no different when you consider AI, not AI, sorry, IT infrastructure, and you consider the IT, all of the bits and pieces go along with that, right? As plumbing, it is just as important as plumbing. So, or electricity. So it should be treated holistically from that perspective. And when it comes to cybersecurity, cybersecurity is just that next layer on that says, well, how do I protect that infrastructure? Again, we all use that term in the IT perspective, but again, if you're coming at this from a non-IT perspective, if you look at it, well, how would I protect my water supply? How would I protect my electrical supply? How do I keep my operations going? Right. I think the biggest fear and the biggest concern that I have seen with some executives who are not necessarily IT related is what happens when the environment is attacked, right? And what is my biggest concern? And the biggest concern is the operational disruption. And that's where the concern should be, at least at the 10,000-foot view, because I should concern myself with, well, if I lose power, I've got a generator. If I lose water, I've got backup means. If I lose plumbing, I can reroute it, whatever the case may be. And if you look at IT infrastructure and the things that protect it, in that case, cybersecurity, and all the layer that goes on around the perimeter and around the inside and all of that bit, it should be viewed in a very similar way. And because the impact to the IT function or the infrastructure that IT provides, whether it's application infrastructure or hardware infrastructure, um, is just as disruptive, if not more so now, than any of those other things, right? In a healthcare system. And when you start worrying and when you start concerning yourself with, well, if this is going to disrupt me operationally, and it's also going to disrupt me clinically, right? So now I don't have access to the tools that I'm normally relying on to make a clinical decision or clinical intervention. All of those things are important, but it also affects cash flow and all of the other things that go along behind the scenes in order to make sure that the health system can run. So this operational aspect of IT and how it impacts operations is exactly the right philosophical approach that senior leaders should be taking to IT and in particular cybersecurity. I think one of the things that is different today from a cybersecurity footprint or cybersecurity concept, really, is that it used to be if you heard somebody got breached, you would immediately think almost as if not only was there a failure at that health system or at that company or what have you, but there's something dirty about that, right? Like they're no longer trustworthy, they're no longer clean, as it were, right? You can never trust them again, that kind of thing. But we've moved beyond the stigma of breaches and the stigma of a ransomware attack and whatnot into, sadly, honestly, a state where everyone's going to get breached at some point. And it's a reality that we must settle in our minds and in our hearts that it's going to happen because we're all a target constantly. And AI only enhances that opportunity,
Yep.
right, for the bad
Yes.
actors.
100%. Yeah.
So from a healthcare perspective, healthcare leadership perspective, it's about enhancing all of the things around the perimeter, right? So that we can prevent the bad guys getting in, making sure that if the bad guys do get in, that we identify it as quickly as possible. But you have to look at it from the perspective of, I'm trying to prevent an operational or clinical disruption, not just protect a technical asset, right, as it were. And so when you look at it from that perspective, you begin to do things like have a very different flavor to the conversations around budgeting, around the right tooling, around the right vendors, and how we vet those vendors, and all of those kinds of things, because it just becomes a slightly different perspective when you look at it from that through that lens. And so I'm not sure that I fully answered your question, but when it's all said and done, cybersecurity is right there at the forefront of what's important, because it is the gatekeeper, as it were, and it is on everyone's mind. It's on my clients' minds, constantly.
Well, you did answer my question because that's exactly some of the challenge that you're seeing everywhere, particularly with the attacks getting more sophisticated with AI and the deep fakes that are going on. It's even more significant to have an AI response, AI defense to it. That's a different conversation with different at a different time. But I think what you said brings an interesting point. This has been a fascinating discussion. The one thing that stands out is how interconnected all of these things, all of these challenges have become. So we're no longer, like you said, we're no longer talking about technology in isolation by itself. Every decision impacts like patient care, operations. You mentioned cash flow, financial performance, compliance, organization resilience. Hey, it's just like you use your water, electricity. This is part of it. So the organization has to be resilient. So I like to shift gears for a moment and kind of look ahead, right? So if you were sitting in front of a, let's say, a leadership team of a major healthcare organization today, what are the three strategic priorities you would tell them that they absolutely cannot ignore over the, let's say, next 3 to 5 years?
So I would classified into three areas. One, a couple of them I think maybe are obvious, and that is AI, right? Because AI is here. It's not going away. And in the 3 to 5 year mark, given the pace of change in the AI, with AI technology and just in the AI community, there's going to be a lot that has to be culled through and a lot that has to be vetted. And as reality sets in, both from just the way the AI industry is funded and the way it's costed, that's going to be one of the big things that every leader is going to have to come to grips with over the next 3 to 5 years, because even the AI vendors now are having to come to grips with it. So you can't just continue to build data center on top of data center and build capacity on top of capacity and then not charge through for all of that capacity, right? And so even the costing models today, whether it's again, individual tools you're using, or you're using the tools through an API or through a black box through another vendor, third-party vendor, something like that, there's, I think, a reckoning coming about the true cost of AI that I think should be on everybody's radar, at least in the back of their minds. But in the overall picture of the 3 to 5 year roadmap, AI is clearly in the mix for everyone to be concerned with. And then the next obvious one, I think, is cybersecurity. And that is because cybersecurity is also being impacted quite significantly, as we've alluded to, by AI, right? And so in that sense, we're back to the AI question. But when it comes to cybersecurity, it's the bad actors are truly using the tools to their advantage. And we also have on the defense side, right, the white hat guys are also using AI to their advantage. And as those new emerging technologies and capabilities within the AI frameworks become available, then we expect and hope that all of those vendors that are providing those defense mechanisms and detection and all of the other things that go along with that are keeping pace with the bad guys. My fear is that there's always going to be a slight lag, and that the bad guys are going to be just slightly ahead of the defense guys. But there's concern there from a 3 to 5 year perspective. If I were a leader of a healthcare environment, to say, how are my vendors also deploying AI on my behalf when it comes to cybersecurity? And then thirdly is regulatorily, if that's a proper word. So when we look at regulations, we are in an administration right now that is kind of both deregulatory and regulatory at the same time. It kind of depends on which day of the week it is. Prime example of that is, this administration was very pro AI, has been very pro AI, issued a number of executive orders and some other directives in order to try to ensure the U.S. dominance in the AI field, both in terms of research and all the other things that are going along with that. And then also turns around and says, well, but you can't release any of your frontier models for 30 days without sending it to us for vetting, right? So regulatory and deregulatory kind of at the same time, right? But over time, and as you know, the politics that are in play for what's happening in the country, and I won't get into which side of any of that I fall on, one way or the other. But when it's all said and done, the regulatory landscape changes constantly, and so from a leadership perspective, there has to be a focus on how are the regulatory changes impacting my day-to-day operations and my day-to-day cost, because the regulatory bodies are responding to the technology and to the reality that we do have things like AI-enhanced cybersecurity attacks and AI-enhanced cybersecurity defense, that we continue to put such a high value properly on clinical data and PHI. And so when you look at all of that, how ultimately is the federal government and the regulatory bodies going to help solve the equation without creating so much overhead and so much cost that it becomes impossible for an organization to either fund it or actually implement it? And so those would be the three areas, and they're tightly sort of related and coupled together.
Yeah. So, talking about AI defense, and I want to mention that Zenix SOG is has built this AI based platform from scratch to use AI to take telemetry from any source anywhere within the organization and be able to cross correlate all of that to identify threats and in real time address it. Like we have now, we are processing 10.8 million events per hour, and we have 40 millisecond threat detection. And that's because of AI, something that was not possible 2 years ago.
That's right.
And
Yeah,
that's,
and
I
that
think that's what
and
you're
that
referring to.
yeah, absolutely. Because when you look at just the sheer volume of data, right? There's no
Yeah,
way an army of humans could not look through all of that and correlate it, right? And that's the importance is the correlation.
that's
And I
key.
look at it too, um, using AI in the cybersecurity space and the SOC space like that, where we're taking in all that telemetry and looking at it, and you're looking for every signal is a symptom of something, right? It's a result of something, and it could indicate a compromise. It could indicate health is positive, or it could indicate health is negative. When I look at it from the clinical perspective, AI is being used in a similar way, right? So, setting aside the sort of basic blocking and tackling of things like transcribing, a patient encounter or notes or helping on the billing side, but where an AI can actually take all of the historical record from a patient and see things that perhaps the 3 or 4 different physicians who are involved in that patient's care over their lifetime didn't see the indicator of compromise, for lack of a better term, the indicator
Right.
that this particular health event was imminent or somewhere in their future, and those kinds of things. And so again, AI does help in the sense that the obvious statement, which is it can cull through massive amounts of data in a relatively short period of time,
Exactly.
whereas no human could possibly do so. And that gives us a unique ability for insights and then action and reaction. On the cybersecurity front, obviously, being able to risk rate those correlations, right, in order to determine whether this was truly an event or not. That's where the white hat guys, certainly organizations like your own, are have to be at the forefront of that, and on the cutting edge of the use of AI and all of that, so that minimizing false positives, but you're culling through just billions and billions and trillions and of data points.
Yeah, yeah. And well said. And that future is actually already here. It's today and available. And that's where AI adds value in terms of defense, right? Yes,
Yeah.
the volume of the data, it's no human can cross correlate this data, correlate this data in a timely fashion. AI could, it's machine speed. That's where the value add
Yeah.
comes in.
Yeah,
So,
I think the biggest risk when it comes to AI, honestly, is in the just sort of raw inference, right? So when you're using AI, again, just an open chat application, or something like that, where there's no where the boundaries are very broad and they're very wide and they're very far out. That's and you let the AI engine do a bunch of inferring, which is all it's ever doing anyway. But when it's trying to do that on such a broad spectrum of knowledge and things like that, that's where you get hallucinations and other things,
yeah,
right?
yeah,
But
correct.
when you tune the AI, right,
100%. Yeah,
specifically to a task like looking for clinical markers of a particular disease state, looking for certain variations of this over images, right? Image studies over time, or in the cybersecurity space, looking for these signals and understanding enough about those signals to know what's noise and what's true compromise. Um, but it's tuned for that, right? That's the real value, I think, of where
hmm,
AI is coming. And
well said.
it's not about just replacing somebody, right? It is truly about um, employing a tool that enhances the activity. Nobody would go back to using a manual typewriter today, right? have word processing, but there was a big leap between manual typewriters and word processing, and there was a big leap between typing something out on a tablet with a chisel and getting to the typewriter, right? And so, and all of the different stages in between. And we're to a point now where AI is here to stay, right? So if I go back to that room of sitting with the executives for the 3 to 5 years, this is what I would say. We're not going to get away from AI. We might call it something different. We might give it a different name. I mean, let's face it, cloud computing is just the modern version of mainframes, right? It's
Yeah.
just all the same. It's all the same thing, just repackaged. AI might get a different name. It might, morph a little bit here or there, but it's here to stay, meaning that it is an enablement tool. And if it's used as in enablement, then there's sort of no end to what it can be used for, in a positive way. Of course, there's the nefarious guys, but in a positive way. And then it's going to become ubiquitous. So it's going to just be embedded into what we do and how we do it. And we will no longer necessarily refer to it as AI as some unique thing. But this is what's important now, is it's not, right? It's not ubiquitous yet. I mean, to hear some say it is, because it certainly touches every day and everybody knows about it. But in the sense that, it's still a unicorn. And because it's still a unicorn, it requires that level of governance and oversight and all of those things. You can't just lump AI in with just any OIT system or any clinical system, right? And so it comes back to, at some point you can, right? Because it'll just be part of the framework of what we do and how we do our work. But until then, it has to be treated separately. And I would say that to any senior leader sitting in a room with them about the impacts of the next 3 to 5 years.
John, I want to say something funny here. Uh, I we are one of the three finalists for the best AI platform built for award from GTIA, which we'll know in a couple of weeks the results of it. And you literally took a portion of my presentation, and you and I haven't talked about this.
No.
It's so interesting, funny in a way, that you took a portion of my presentation about what we've done and what AI for defense, and you literally articulated in the past 2 minutes. And I appreciate it. It makes a lot of sense. Um, so one of the goals of this podcast is to give our audience practical ideas that they can take back to their organizations. So I'd like to ask you, let's say, a rapid fire series of questions. Think
Okay.
of this as advice you would give every healthcare executive listening today. Okay, ready? And
Ready.
this could be short answers, right? Biggest mistake executives make.
Oh, underestimating the amount of effort that it takes to implement and change an organization for implementation of a large scale system like an EMR, which we're kind of over that nowadays, but AI or other solutions. So underestimating the effort involved.
Awesome. Biggest opportunity.
Biggest opportunity. I would say, not again. I'm not an AI apologist, but it does come down to the biggest opportunity today is to use AI where appropriate. AI is not a solution for everything, as we've kind of talked about, but where you have point solutions that are proven, that are protected, that are secure, and all of those kinds of things, there's no reason not to deploy those and employ those, to benefit both your operations as well as your patients.
Okay. Next one. One investment worth making.
People. So I know that kind of goes against, again, what some of the hype is around AI, but when it's all said and done, um, AI is only going to produce some result, right? That still needs to be validated in some way. It might be able to call through, like your solution that calls through millions of signals. In the end, whenever it surfaces something that says, "Hey, this might be a real problem. This might be a real attack," some human eyes need to be on it, right? And when you look at that from the clinical perspective, you don't necessarily want these AI systems to be making clinical interventions directly. And so you want a physician, you want a nurse, somebody to be involved in that to say, yes, this is the right decision to be made at this time.
One technology that's overhyped. I think I know the answer.
Yeah, I would say in general it is AI,
Yeah.
because it is sold as the be all end all, right? And when it's sold as the be all end all, I think the logical person would sit back and go, okay, I know that that's not true. It can't solve every world problem, but perhaps I can use it for a very specific thing. And that's exactly the problem, is trying to cut through all of that hype and find the right solution for the right problem, and not just think of everything as a general AI solution.
Okay. One trend everyone should prepare for.
One trend everyone should prepare for. Um, I'm going to say this, and this is right off the top of my head, truly, de-skilling. So with the use of AI and with the use of technology in general, it doesn't have to necessarily be AI. We lose skills. I no longer know how to cut down a tree, right? I don't know how to skin a squirrel, even though I've got plenty of people in my family and in my past who do know how to do those things. But I can just go to the store and buy, me some hamburger meat or whatever. I don't have to know how to go out and slaughter a cow. To use a really, illustrative illustration there. But when it's all said and done, if I'm letting the AI do a clinical intervention or make clinical decisions, then I'm eventually going to forget the information that I need in order to validate whether or not that clinical intervention is the right thing. If I let AI do all of my programming, then I'm going to forget how to program. It's just a natural thing that's going to happen. So I think that there is a real potential in the future for de-skilling, and then we become reliant on a technology that we, again, should be ubiquitous, but it also needs to be bounded in the sense that it needs to be used for us and not used against us.
One last question. One leadership lesson you've learned.
Oh, the leadership lesson that I have learned. You have to let people do what you've hired them to do. So I have been involved in situations where I have been macro managed. I've been involved in situations where I've been micromanaged. Certainly prefer the management approach. But when it's all said and done, you have to trust the people to get the work done that you've hired them to do. And I think from a leadership perspective, that also includes another lesson. I know you said one, but the other lesson that kind of leads into that is the change management side of any sort of change. So with technology adoption, building a new hospital, changing a clinical workflow, it doesn't matter, right? The leadership has to be sure that they are investing in the overall change management that's associated with getting somebody to say, I used to do it this way, now I'm going to do it this way. And I think that's a big area of, I think, project failures and implementation failures, and ultimately consternation for everybody in the workforce when change management isn't handled properly.
What a fantastic conversation. Well, we've reached towards the end of our time. I want to sincerely thank our guest, John, for sharing his experience, insight, and practical advice. Healthcare continues to evolve at an incredible pace, and conversations like today's, remind us that success isn't just about adopting new technology. It's about having the right strategy, the right leadership, and the willingness to embrace change thoughtfully. To everyone watching or listening, thank you for spending your time with us. If you found today's discussion valuable, please subscribe, share this episode with your colleagues, and follow the Zenex Executive Insight podcast for more conversations with leaders who are shaping the future of healthcare, cybersecurity, and AI. Until next time, stay curious, stay informed, and continue leading with purpose. Thank you for joining us.
Thank you.
Thank you, John.